Dr. Dom, welcome to the podcast. You are a biological dentist who's on a mission to sound the alarm that health and disease starts in the mouth. And if we don't question our traditional approach to dentistry and many of the treatments that come along with it, we could find ourselves chronically ill for life. And one of the areas that you're sounding the alarm the most on is the topic of root canals. So what the heck is the problem with root canals, and what are some of the myths that you want to bust when it comes to this intervention in dentistry?
That's a good question to start with. Root canals are still, I would say, is the most controversial topic in whole dentistry because it's a standard treatment that we need to bring people acutely out of pain. That's basically how it was invented for. But what we do is we leave something dead in the body. And I always think it was never a good idea to leave a dead body part in the body, and no other medical department would do that. Obviously, you can still bite on root canals. It's a fine art. It's craftsmanship that you need. So all the dentists out there that do a great job with it. But if you see it from a biological point of view, which evolves around optimizing health starting from the mouth, a root canal is a dead body part. A tooth is an organ. It's kind of like an extension of your brain. It has usually a blood supply, it has a lymph supply, an autonomic nervous system, so parasympathetic, sympathetic nervous system in the tooth. But as soon as you have that massive pain and you take out all the vital parts, which is essentially a root canal, you take out the immune system. And then it becomes a dead shell. And if you look at an electron microscope of that root canal, of a root, you see that within like a square millimeter, we have about 30,000 to 75,000 little tiny tubes, dentin tubules, where all the oral microbes, especially the anaerobic ones, can then jump in and live there. So it becomes a cave for bacteria and a chronic infection over time. And if your body has an immune system, it will attack that chronic infection. Problem is, the innate immune system, like the macrophages, they're a little bit too big for these dentin tubules, so they cannot really come in, but build something around that tip of the root. And if you do a good diagnosis and use a cone beam scan, which is a 3-dimensional X-ray of the teeth, you will see that most of the root canals, let's say at least 80%, have some sort of chronic inflammation around them. For example, just like a little cyst on top of that tooth. And the problem is, chronic inflammation, as you know, is the lead way to chronic disease. And this is the epidemic of the 21st century. So if it's about just biting, a root canal is fine. But if we are talking about optimizing your health, this might be the splinter, the single one trigger that holds you back from superhuman health.
As a biological dentist who often interfaces and works with patients in a team, meaning you're often in touch with their doctor, you could be in touch with their neurologist, you could be in touch with other people, their functional medicine doctor, because a lot of these patients have had issues and symptoms for years that they haven't been able to figure out. What are some examples of chronic symptoms that you've seen people deal with that you found was connected to, in some portion, the chronic inflammation that was there left over from a root canal done incorrectly?
Yeah, it's not necessarily always incorrectly. It's just the root canal in itself is a little bit flawed because over time it will just be reinfected with bacteria, even though we might be very good with disinfecting it in the first place. But basically all chronic health issues can have some sort of a correlation to something that is triggering. So it could be gut issues, could be skin, eczema, acne, psoriasis connected to some sort of dead material in your body. Could be mental health issues. There are actually studies showing that the lipopolysaccharides, that's basically metabolites from anaerobic bacteria from root canals, can lead to depression and bad quality of life. And I don't think that we need that. I feel it's at least should be informed consent. But also neurological issues, neuroinflammation, multiple sclerosis. There's anything that you would think of, any little diagnosis could be backlinked to something that triggers. Especially if you're already optimizing everything. You have your diet in check, you're tracking your sleep, you go outside in nature, you're grounding, all the things that biohackers do or health optimization people do, but you're still not superhuman. Then it's at least time to look in the mouth for, let's say, a hidden health hazard that might be lurking in there and you don't even know about it. And the problem is the conventional dentists don't combine this. They just look at it for biting. And does it hurt would be the one question that they ask. Usually something chronic doesn't even hurt, so it's a problem. You have to really understand how the complete body works and that this might be holding you back.
You mentioned it yourself. This is probably one of the top 3 most controversial things when it comes to dentistry. We're going to talk about some of the other controversies later on in this episode, but I want to stick on root canals for a second. Help our audience understand, why is it so controversial that biological dentists are saying, hey, maybe we don't need this intervention. And actually, if people have gotten it done before and they have unexplained symptoms that they haven't been able to get to the root of, neurological symptoms, a whole host of different things, even eczema, dry skin, etc. Why is it so controversial to say, let's get a scan? I think you called it a cone scan?
Cone beam
scan,
yeah.
3-dimensional x-ray.
Yes.
And let's see if there's inflammation that's there. Why is that controversial?
The controversy is actually that conventional dentists don't look at the overall body health. For them, it's just like the mouth is kind of like not a part of the body, versus biological dentists would say it's the entrance to the body. And whatever you do there mechanically might be affecting the whole body due to cytokines, due to inflammation, due to the other things. The problem is it's not connected. So in dental school, a root canal is just a fine art. That's it. It works. And it works for biting. So conventional dentistry basically is fixing bites and smiles. And biodentistry, the way how we define it, the 3.0 version at least, is obviously high-tech dentistry, the fine art, but we're melting it with functional medicine and health optimization and biohacking to optimize that complete body. And this is where I think there's just knowledge gaps that are existing that this could actually work systemically. It's kind of like the mouth is not part of the body. So biodentistry incorporates it as the entrance to the whole gut system. And therefore, obviously, we look different. And if I get a panoramic X-ray, just a 2-dimensional one of a patient, I always look for 3 different things. Or I ask them, any metals? Have you had root canals? All these cavitations? Because I want to see, is there something that might be holding back the immune system, the nervous system? So it's just about giving more information to the patients, but also to the dentists. And that's why I'm training them to understand the bigger part. And this is actually the more complex thing, because the techniques to train the techniques is usually the easier part for dentists because they're already good with their hands. But seeing that we're really medical doctors actually that can help overall, this is the missing link. But I think this is the dental evolution. This is the next level. This is the fulfilling part for me, that I can help patients heal overall. We just help the body, because I would say the most unnatural thing in your body, the one thing you cannot biohack away, is dental repair. And a root canal is a repaired thing.
Okay, we're going to talk about root canals in detail a little bit, starting with some of the basics, but I want to address this head on. This podcast has a big following, and you also have a big following as well. You've been on some of the top podcasts that are out there, and I've watched a bunch of them, and I've seen dentists comment in the comments on YouTube, on your social media, and the comments will look something like, how dare you, you're fear-mongering, this is not proven. There's no research. That's a general sort of thing that people say. And also the interventions that many biological dentists are talking about often are expensive or not covered by insurance, and you're going to have a patient go down a super complicated rabbit hole. You've seen this criticism more than anybody because you're on the front lines of it, right? Help our audience understand, who are going on YouTube, who are searching, who are just looking for answers, who have maybe had a root canal like my mom did, and started asking around and saying, should I be worried about it? And I found a biological dentist for her. And that biological dentist sat down and listened to her, heard her symptoms, heard her story, talked to her about why she shouldn't have guilt that it happened. It was already in the past, but that they should still put a plan together to get out of the pain and the inflammation that she was dealing with. I'll chat more about my mom in a second. Let's deal with some of the criticism. Fear-mongering, there's no research, you are getting people excited about something, and there must be some sort of financial motive that you have for doing it. What do you want to say about that?
Yeah, I'm on that journey for such a long time. Like that's my sole mission, is to change dentistry the way it's done right now, or the overall system. So I had a fair share of, let's say, arrows in my back the last 10 years, especially when my book came out 5 years ago. Probably had a love letter from any single professor in whole Germany, at least, and tons of shitstorms. So I'm used to it. I know that has nothing to do with me, actually. It's actually just the fear of change. And I'm actually not fear-mongering. The only thing I'm trying to get across is new information, that we might need to upgrade something that is old school, that worked maybe 50 years ago, but we are changing our whole lifestyle, the epigenetics, the whole life has changed dramatically, like the surroundings in the last 100 years. So we need different approaches, and the epidemic is chronic disease. And if we as dentists can do something about it, I think it's a good thing. Is there any financial aspect to it? I mean, I'm a dentist, but my goal is actually so that my patients never need a dentist again, or at least in the future that we don't actually need a dentist. That is the goal, because if our lifestyle supports overall health, our body's immune against tooth decay. If you never have tooth decay, you never need to see a dentist. There's never going to be a root canal. There's never going to be an extracted wisdom tooth. So it's obviously down the line a lot, because right now we need repair. But and the research question, this is always what they bring. There is no research, but there's tons of research. But you have to understand sciences. You have to understand microbiology. You have to understand physics. You have to understand biochemistry. You have to understand chemistry, all the different sciences, and then look specifically for your reason. It's obviously not dental research all the time. You would probably not find anything against root canals in a conventional dentistry magazine. Why would you?
They may not even want to study it in the first place.
No, but for example, 10 years ago, I wanted to bring out my first article about root canals. And I researched it quite well. So I had a lot of research, and I asked all the single magazines in Germany to print it. They will all say no. The problem was it was very well researched, but it will lead to extractions and maybe a fear of change and whatever. But there was one online platform, the biggest one for dentists. They said, okay, we just post it online. And this was the most read article within 24 hours. This is more than 10 years ago. And it led to obviously another flood of shitstorms and everything. But it showed that there is interest, because people, if you're as a dentist or patients, if you feel that something is missing, that you're still not there yet, that something is holding you back, it might actually be that root canal. So there's lots of research showing, for example, that a dead tooth has no more live immune system in it. So if there's no more immune system, it can't attack the bacteria. So it becomes okay. That's dental research. Then there's also research that, again, with the depression, it's also dental research. You just have to actually go to PubMed or Google Scholar and just look for it. Problem is, most people that point to that research, even though you show them then the research in the comment section, they don't even listen to it. They don't even read it, or they read it the other way around. Because research can always be interpreted this way or the other way, depending on maybe you're biased. But it's not about me. I'm not interested in, is this correct or not correct? I'm just seeing results for patients. And I'm just there to help them on their health journey. And obviously, the definition of health in medical school or in dental school is just absence of disease. And in dental school is mainly, can you bite on these teeth and are you free of pain? But we can help patients overall. And this is the fulfilling part for me. If they tell me, I've seen 29 doctors before you, I had depression, I had gut health issues, I had joint problems, frozen shoulder, problem with my knees. But now, just one day after surgery, 90% is gone. This gives me goosebumps every single day. And this is why I love that. And this is why I don't care about these comments, because I know everyone is afraid of change. We need that change. So that's how we do it.
Let's build from there with the basics. And it's not just root canals that you're worried about. There's cavitations, wisdom teeth. We're going to chat about that in a second. But we have the attention of people who've had a root canal, and we have the attention of people who their dentist is saying, hey, maybe you might need to get a root canal. And we also have the attention of young people who are trying to help their parents figure out, make the right decisions, especially as they get older. And a huge part of my motivation of why I've interviewed so many biological dentists like yourself and cutting edge functional dentists is that I've seen my parents who had access to good healthcare our entire lives. I've seen them have poor quality dental care, even though it was considered great dental care. And now they're making up for it in their older ages and trying to fix stuff or deal with other chronic issues as a result of poor decisions that were made that the dentist knew that it was just the best that they knew at the time.
Yes.
Right? Mercury fillings and root canals and extracts, etc. So that's my motivation. So now that we have everybody's attention, let's cover the basics. Remind everybody in a most fundamental way, why would a traditional dentist recommend a root canal?
So usually the main recommendation comes from massive pain. So if you had let's say a decay, a cavity in your tooth that is huge and goes to the nerve, you are in pain. The pain is a neuralgia pain because the teeth are an extension of your brain, so it's directly connected. So this is why we need to perform root canals, to just get you out of pain. It's super important. This is also the only time when we would do a root canal. For us, a root canal is just a temporary. I oftentimes actually get the question or in the comment section, my dentist recommended a root canal. Should I do it or not? And I'm like, okay, why did he recommend it? Because it seems like you don't have pain, right? So sometimes they just recommend it because they feel that when they now maybe they had like a little bit of decay and they need a crown. So a little bit of the tooth is destroyed. So the dentist wants to restore it and they prepare it for a crown. A lot of dentists actually are afraid that by prepping the tooth, that the tooth will die in the long run, and perform a root canal at the same time so that they don't have pain in the future. So oftentimes teeth get killed just as a preventative measurement for their prosthetics, which is unnecessary. There's actually countries, I don't know if it's still the case, but in France it was the case that I had seen patients, they were young, like even younger than me, they had beautiful teeth, all Hollywood smile, but on the x-ray, every single tooth was a root canal because that was their normal regulations in dentistry in France to just do a root canal when you do crown work, to kill that tooth because maybe in the future, because of prepping the tooth, it will die anyways. So unnecessary root canals are oftentimes the case. So if you don't have any pain right now, you don't need a root canal.
Is it also true, I heard a dentist say on this podcast, if I'm not misunderstanding, that often root canals are done to try to just keep a tooth rather than putting in a prosthetic, right? Like that you don't have to get rid of that tooth. You can keep that tooth.
I mean, yes, but it has to be,
I'm not saying that's a good idea.
No,
I'm saying that's the motivation for a lot of people, that they don't want to lose that tooth and put in, what's the name for a prosthetic?
In this case, if you have to extract a tooth, the next thing is a dental implant.
Yeah.
Yes. Yeah, I completely understand why they do root canals. That makes sense. It's to keep that tooth for biting.
Right.
But again, you keep a dead shell and it comes with a couple of challenges that we already touched on. So bacterial invasion, chronic infection, dead shell, then decomposing of any organic material in the body. Like anything organic decomposes. If you eat a fish or whatever, leftovers in the bin, they will stink up the place.
In the trash.
Yeah, in the trash. Like it will just stink. Same here. Like we have different byproducts from these teeth, just in a tiny little amount, but it's just that. But biting totally works. So I understand why we have the root canals completely. Obviously, the goal would be to change the whole approach so that we don't focus on dental repair in the first place, but focus on getting our patients out of these soft teeth, out of the decay, out of these chronic health issues, because tooth decay is #1 chronic health disease worldwide, as well as gingivitis. So if we would focus on optimizing the overall lifestyle so it supports our teeth to become hard as stone and no bleeding gums and all these things, then we wouldn't need a root canal or anything. Then we have our real, healthy, alive teeth in place to bite on. That would be ideal. But like your parents or my parents, they had their mercury fillings, they had their root canal, they had infected root canals, they maybe have titanium implants now, they have bridges. So what we see is like, there's a lot of dental repair that needs to be fixed in a more biocompatible way, not triggering your immune system and your nervous system.
Today, if somebody who's listening goes to the dentist and their dentist says, hey, you're going to need a root canal, right? What's the first thing they should do? Should they get a second opinion from somebody who is like a dentist in your network or a biological dentist? What should they do? If somebody's getting a call, they haven't gotten a root canal yet, and their dentist is maybe pressuring them a little bit, and they're giving their explanation and reasoning. Maybe there's pain, maybe there's not pain. What should they do? Should they get a second opinion?
Yeah, I would say there's two scenarios. If you really are in pain, yes, get that root canal. Don't freak out. A root canal is fine for a couple of years most of the time, depending on your health status. If you're super sick, then maybe not, but your body might compensate for it. But if you have nothing and he just recommends root canal, I personally would get a second opinion and maybe look for a more open-minded dentist that looks totally different at it.
Yeah.
And maybe just supports the body.
Okay, great. Just want to mention it. We'll put the link in the show notes. You have a group of dentists you've trained that are in this classification of real biological dentists. You have a database online? People can search it?
Exactly. I have a database online. You just can also DM me and I'll send it out. The real biodentist is how I call the tribe. Those are the ones that understand all, let's say, the intricacies of biodentistry from a technical side of things. So they know about the root canal issues, the metals, cavitations, the technical side of things and how to fix it. But they're also trained in the more holistic approach. They know how to detox the body. They know how to use nutrition, to use the right micronutrients, the bone healing protocol. So they're more complete. I've trained thousands of dentists before, but some of them are on this level, on that level. So I needed to create a tribe that has one standard that is really the next level. So that's called the real biodentist. And there are a couple of them already in the US, even in LA. And I'm working.
Presence is in Germany because that's where you're from. Right.
So the real biodentist
concentration
is actually US.
US. Okay, great.
Yeah.
Amazing.
Germany are a lot of the good ones too. They're called the specialists, but they're merging into it. So I'm trying to pick all the ones that I've trained over the last decade. They're not called real biodentists and bring them into the same tribe. So we all merge it together and have one solid.
You're focused on the education piece and making sure that there's a standard approach so people can find the right people.
Exactly. Because the problem is, maybe also because of my work for that long time, that it becomes a little bit of a trend. And at least in Germany, there's a lot of piggybacking. So dentists will have a great, let's say, online presence and tell patients they're doing everything. They're doing that for 30 years. They remove all metals safely. They do ceramic implants, all the things. And they're trained by me, but they're not. And this is really bad for patients and also gives bad rep again for biodentistry. And for me, the goal is to just help change the dentistry, because actually every single conventional dentist, if they would understand what I'm talking about, that they would just realize, wow, we are just upgrading. We're not just the dentist anymore that just builds, fills, and drills, but become a real doctor. They would love it because our patients are not, oh, I have to go to the dentist and see Dr. Dominik. It's more like, wow, we go to see him, we prepare, and it's all about overall health, and they do nice teeth at the same time. So it becomes a really fulfilling job. So it needs that next level, just a dental evolution. It's nothing.
In my experience, that's what all the practitioners, medical doctor, dentist, they're all looking for more fulfillment of actually moving the needle forward for patients' real health, right? They're all looking for that. So if they can find the right courses and stuff that can help them, amazing. Okay, before we get too far on a tangent, I want to bring it back to root canals because I just want to walk through a few things. So first things first, if your dentist tells you that you need a root canal and there's pain, don't freak out. We're not here to fearmonger.
Exactly.
Your body, especially if you are practicing, you're eating clean, minimizing ultra-processed foods, you're getting in movement, you're not dealing already with some sort of chronic autoimmune or illness or cancer or something else, you're going to be fine. The body is resilient and you're going to be okay. And then maybe you look for a biological dentist as you have time and you slowly start switching that direction. Now, if you don't have pain, get a second opinion, and we'll link to the directory that you have that's out there. I have a couple dentists. I don't know if they've been trained by you. My guess is probably not, but some pretty good recommendations in the LA area of people that I've personally worked with that I can mention as well, that we've done previous episodes with. If you've had a root canal and you start to suspect that this is interesting, when I had my root canal, it was like 6 months or 3 months or a year later that these issues started showing up, or I've listened to multiple podcasts and I'm connecting the dots for myself and I'm just asking questions, right? Because I'm dealing with these unexplained symptoms. I've had maybe one or more root canals that are there. What is your first step if you're one of these people? Is it to find a trained biological dentist, talk to them about what you're going through, and then possibly get this 3D scan?
Yes. Number one is don't freak out. Like you just said it perfectly. Work on a strategy. really do some research. I mean, this is why I've created a tribe to find people that are skilled in all the sets, because what we also do in biodentistry is streamline everything. That means patients have time, because this is something that they have in their mouth anyways for a couple of years, root canals, metals. So we can always plan to restore the complete bite with biomaterials in one health optimization week. That's what we do. In order to get there, we prepare patients overall. And then maybe that's why it's quite charming probably for patients, because most of them actually fly in from all over the world. It's more people coming from internationally to Germany than they're coming from Germany. It's funny, right? But I think it's because they know, okay, we're getting prepared. And in this week, we remove the metal safely, obviously. We take out all the root canals and put immediate ceramic implants. We can touch this one for sure, because this is something most biodentists even don't do. And then we also deal with the so-called cavitations in 1 week. In order to do so, we prepare them with the right nutrition, the right micronutrients, and then on site we have everything covered with IVs, hyperbaric oxygen.
So you guys basically have, you're saying that you guys have a complete package that if people have the resources, they can fly to you, they're willing to invest into it. And these are a lot of people that have dealt with issues for years. For a lot of them, they're motivated, right?
Exactly. And that there is a strategy. I mean, this is the complete strategy, but you should have someone who knows at least steps of it.
Right. Find your team, put your team together.
That's number one.
Now, something that a lot of people don't know is that gut health actually starts in the mouth. That's one of your core principles.
Yeah.
Help us understand and give us an example after you give your basic explanation of how that could work in your favor or negatively for you if you have an inflamed root canal. So talk about gut health starting in the mouth. What do you mean by that?
So for me, the mouth is the entrance to the gut system. It's kind of like that tube that starts here and ends over there. And in between is obviously the gut system that we all talk about.
And if you're not watching on video, you're talking about starts in the mouth and goes to the rectum.
Exactly. That's
right?
one tube, right?
Right.
Exactly. Perfect. And what people maybe don't know, like in this realm, obviously a microbiome is something people are familiar with, but usually we talk about the gut microbiome, but we have various different microbiomes. We have a skin microbiome, basically everywhere is a microbiome, but we also have a huge oral microbiome. It's actually the second largest microbiome in the body and the most diversified, meaning many more species than down in the gut system. And you swallow about 140 billion bugs per day. These bugs that you swallow make about 50% of that gut microbiome.
You're saying bugs like bacteria?
It's not just bacteria in your mouth. It's bacteria, it's parasites, it's viruses, it's fungi. It's like the complete system. That's why I call them bugs. Let's say microbes.
Microbes. Okay, got it.
Bugs in exclamation mark. Yeah. Good. The good ones, the bad ones. I mean, we are only 10%. At the end of the life, we are only 10% human cells and 90% is made of, let's say, bugs. Even our mitochondria is bacterial DNA. So they're not good or bad. It's just this oral microbiome can be completely dysbiotic, meaning it's not really in balance anymore because of, let's say, dental repair, because of one root canal that is infected, because it's full of, let's say, the more bad bugs or lots of tooth decay. So if you have imbalanced microbiome in your mouth, it obviously is the same in the gut because you swallow it every single day. So any sort of gut healing protocol, which involves skin healing and all these things, should always start in the mouth because this is the entrance to the gut system. And any sort of dental repair, metals or root canals or removed wisdom teeth or what else you could have, is changing that microbiome from here and then to the rectum. So this is why it's so important.
I think part of what you were also hinting at is that one way is it goes through the digestive tract, right? And some of these bugs can pass through sort of our digestive acids, end up in our sort of small intestines, large intestines, small intestines, and cross through. Another thing that you and a lot of biological dentists are trying to highlight is that because the unique nature of a root canal and these tubes that come in, these dental tubes, there's also a direct pathway into the bloodstream. Is that accurate or not accurate?
Yes.
Like if there's bacteria.
Yeah. So the bacteria from that tooth, or even from everywhere, they can just basically go through the lymph system through the blood supply. Like within a minute, it's basically in the whole body. So they can
skip the digestive tract.
Yeah, they completely skip it. And they can also go through the nerve. Like if you look at an anatomical chart of the brain nerves that start in the brainstem, the cranial nerves, number 5 is called the trigeminal nerve. And it goes basically from here to here to here, it has 3 branches. And at the end of that nerve is the tooth. So all the bacteria in the tooth or the viruses or whatever lives in there, even the mercury can go directly back towards the brain, which is called retrograde axonal transport, and then inflame your hypothalamus, your pituitary, your ganglia. So it's various different routes that these bacteria can go. And it's not just swallowing it.
Right. It doesn't have to be just swallowing, although that's a big contribution.
Yes.
It could be a root canal that has gone wrong and is inflamed, and somebody hasn't dealt with it. It's been there for years, and it could be slowly poisoning them. Is that accurate to say?
Yes. And the problem is, it's usually a chronic inflammation, meaning your body has adapted to it because our body is very resilient and just turned down the volume. So it's not painful anymore. And unfortunately, the dentist will most likely ask you, are you having any pain? But which chronic disease is painful? Most of them are not. So I see patients having a panoramic x-ray with huge cysts underneath these root canals, which is basically just the immune system trying to get away from that infected tooth. But and obviously these cysts destroy the whole bone around it, but the dentist didn't do anything against it because it didn't hurt.
Right. So they're looking for traditional pain, and yet you have these unexplained symptoms and no doctors are talking to each other. So there's no connecting of the dots.
Exactly. For example, I had a patient, just comes to mind right now. He had seen a lot of integrative medical doctors, even in the US, very good ones. And he always had rheumatoid arthritis. They did everything. You can understand, like nutrition, everything, every single supplement. They tried it all. And the rheumatoid arthritis factor was still high. And he still had his joint issues, obviously. And then, I don't know which one was it, but someone pointed, hey, maybe it's the oral health. Maybe you have some problems in the mouth, and connected him to me. And we just saw, okay, again, metals, root canals, infected root canals, and cavitations. He flew in, and he had a lot of tests from his oral microbiome from before, because he always would measure the oral microbiome, how it presented. And there was usually a couple of, let's say, microbes that were more expressed, like the more, let's say, the negative ones, the more bad bugs, which is Porphyromonas gingivalis and Streptococcus mutans. That is some like the bad guys in dentistry,
which have a lot of research on them of being connected to heart disease.
Yes.
Crossing the brain-blood barrier, having some connection potentially to Alzheimer's disease. Like that's established. Like
exactly.
That we know.
And also they're established being connected to rheumatoid arthritis, especially the PG one, the Porphyromonas. So I cannot give any guarantees, but I just said, okay, there is a couple of, let's say, inflammatory sites that we need to deal with chronically. And we replaced all the root canals, obviously clean everything perfectly. We can go into this, place ceramic implants. And on the next day, and this is I have that as a reel in my Instagram, because he said, people don't want to believe this or can't believe this, but my joint problems are actually gone day after surgery. And then he followed up, like, let's say 4 weeks after surgery, he did another oral microbiome test. And the bad bug was completely gone. And his rheumatoid arthritis factor went down by 50%. So bacteria, 100% eradicated just by taking out the root canals and all the old stuff. And his joint problems are gone. And this happens basically with all patients, that there's some sort of overall health improvement. And this is, like I said before, this is still a fulfilling part if you're a doctor.
Yeah. And I think that, you seem like a super grounded person. You seem like you want to present all this in a balanced way. And there's your clinical experience that's showing you that a lot of patients get better. I do like to add in, because many people who listen to this podcast, they'll hear well-meaning clinicians who are the expert in their area. Their approach could be biological dentistry. Somebody else is an expert in making sure that we get adequate levels of sun exposure, which is an important part. Somebody else is a big fan of raw milk and biosoluble vitamins and other things. Somebody else has an autoimmune diet, and they're all having great experience. And I think that what you're saying and what I'm hearing from you correct me if this is wrong. You see often the patients that are at the worst of the worst. They've tried a lot of things. And for many of the people that sort of match and have the motivation to say, okay, I'm going to come to Germany to see you, or maybe seek out one of the other biological dentists you train, they've been doing some digging. They've been listening to your podcast, other stuff, and they've started to be a little bit of like a health detective and say, hey, this sounds like I'm the type of person to fit. Right. Yes. And many of them see improvement. I'm sure you've had some people that they saw some improvement, but maybe it wasn't the full thing. If there was at least one person that's there, the only reason I'm bringing that up is that I like that you use the word maybe, because you're doing two things on today's episode. You are reminding people we're not fear mongering.
No.
And you're reminding people that you should know about this because nobody's talking about this. At least listen to a few more podcasts with you, at least dig in a little bit further, at least get a second opinion and educated. And maybe if you are having these issues, rheumatoid arthritis, you mentioned MS,
yes,
and some of the bacteria, I want to talk to you about that. I'm actually very interested in that. Then it's at least worth digging into if nobody else has figured it out. So that's my softer way to say the same thing that you're saying. Do you have any problem with that statement that I shared?
No, that's actually perfect. That's what I want to say. It's the most underrated part. It's always not talked about the mouth because it's not connected. Dentistry is not connected to medicine. And therefore, there are so many specialties. It's perfect what you just said. That's exactly how we do it. Maybe it can help, especially if you already do all the other things, which you should do. So it's a complete thing. Just don't forget that part.
You mentioned rheumatoid arthritis, right? Rheumatoid arthritis is an autoimmune condition, right? That makes a lot of sense to me, that autoimmune is your body attacking itself. And we've had different experts on this podcast talk about the different ways that autoimmune can get started. And one of the things that many of them, all of them actually talk about is it's a three-legged stool, and there's a few different parts of that stool. But one of the important pieces is there's often some sort of infection or trigger or trauma.
Yes.
That's initially there. And in the case of connecting the dots between root canals, but also other potential extractions that got inflamed, what you're saying is that if there is this chronic infection, sure, you may not have pain, your body's adapted, you may not have dental issues locally, but if there's this seepage, almost like a sepsis type event where you're leaking into your body,
low grade, yes.
Low grade, then your immune system could be super heightened. So maybe your CRP is elevated.
Yes.
Maybe your interleukin 6 is elevated, or one of these other markers that's GF alpha, right? Anything else that you would mention?
No, exactly. This is you completely understand it.
Yeah, so these things are triggered in the body, and your body is just constantly attacking. Now, if your body ramps up the attack, it's like having a border to a country where people who are bad actors, right, are constantly coming in. And let's say that a lot of them are brown. I'm brown. And then the government starts to freak out and say, hey, arrest anybody that's brown because we don't know who's causing the problem, right? And so it starts arresting everybody, even if they're not having an issue. And so that's how rheumatoid arthritis is your body attacking its own joints. MS is your body attacking its myelin sheath, the fatty layer around the nervous system and the nerves and the neurons, because it's gone haywire. So if I'm understanding you correctly, you're saying this low-grade chronic inflammation continues to ramp up the immune system, and in some instances, for some people, could be this trigger of autoimmune-like behavior or full-on autoimmunity in the body.
Perfect. Now we're getting there. Exactly. If you understand cytokines and all these things, you completely understand. This is a big part of the biodentistry training, that you have to understand the systemic part of things, that TNF-alpha, interleukin, that these are sort of putting the whole body in a stress, in a more aggressive mode, in a, what do you say, havoc, haywire, that's a nice word.
Haywire.
Yeah, the immune system is in attack mode, is not balanced anymore. It's not about nuking everything. It's just about getting it back to balance. And yes, if there's something chronically there triggering it, your body's not stupid. It doesn't just attack the myelin sheath or just the Hashimoto's, the thyroid, or the joints for no reason. Usually does it because it sees something as wrong. Or like you said, just the brown dude, just because it's brown. So it's just a mismatch, and like you said, it's perfect. It's just in attack mode. So what we need to do is modulate the immune system instead of killing stuff off. And I also see the problem in integrative medicine that people always try to let's do a parasite cleanse, kill it all off, and let's do this now, and then do the heavy metal chelation. But there's again no balance to it, and maybe they didn't really put attention to foundations, such as stuff in the mouth. And this is oftentimes root source. It's the foundational part, and no one talks about it. So it's really important to get that immune system back in balance, to modulating it.
I want to mention one other autoimmune disease I mentioned earlier, MS.
Yes.
You talked about how there's a well-established bacteria, or like a bacterial strain, that if you search it in PubMed, you were on a top podcast, and you were saying that there's a lot of understanding that this bacteria has a relationship to MS. Do you know which bacteria I'm talking about?
It's not the bacteria, that's a chemokine, actually.
Okay, chemokine.
So what is that? Chemokine is kind of like a cytokine, a bit different.
Okay, got it.
And in this case, the chemokine is called Rantes, R-A-N-T.
Rantes, right.
Rantes. Or in medical world, you could just PubMed or look for CCL5, chemokine lignin 5. Is nothing bad. Basically, initially, if you have some sort of trauma in the body, it's initially there to help rebuild the construction site. But if the construction site doesn't heal, it becomes chronically activated and then it causes problems. So if you, for example, do the PubMed or Google Scholar search for MS and CCL5 or Rantes, you'll probably find 1,000 papers. But the papers are in medical world. So no dentist has ever heard of these papers. Problem is no dentist has ever heard of these Rantes and cavitations because it's not taught in dental school. So medicine is looking for Rantes and CCL5 and dentists don't know that it is maybe in the cavitations, even though there is research. So this is something that we need to learn. And this is obviously something that most dentists will write in the comments, bullshit. It's woo-woo. It's not even existing. But there is great research that it's existing, and we are there to just change that.
There's research there. It's just nobody's, again, talking and connecting the dots. You've mentioned a word here that some people know and a lot of people don't know. Cavitation.
Yeah.
Right? Obviously, there's a connection to root canals, but cavitation is more than just root canals. So just explain, right? Like if you have anything extracted,
yes,
then that is a cavitation. So just explain in your own words, what is a cavitation and where can it go wrong and contribute to a chronic issue?
So cavitation is the layman's term for something, but basically a chronic jawbone inflammation. In medical world, it would be called FDOJ, fatty degenerative osteonecrotic jawbone, because that's what it is. And this can happen after any sort of tooth extraction. It's basically you're taking out something and your body wasn't prepared systemically to heal that side. It was kind of like a shock for the system. Maybe too much trauma, big surgery, huge cavitation, huge wisdom tooth extraction, huge swelling, wrong timing, no nutritional support. And then this side doesn't heal in the long run, just secondarily. And what happens is instead of having solid bone where we had extracted the tooth, we only have the gum on top. We have maybe the cortical part on top, but inside where we usually have like sponges bone, there's nothing but fat, fatty tissue, degeneration, osteonecrosis. Is basically dead bone. And this again is a huge cave, that's why it's called cavitations in layman's term, for again, anaerobic bacteria, parasites, viruses, fungi, you name it, even mercury, glyphosates. It's kind of like a huge dumping area. And this is something you do not learn in dental school. Not yet. We're on it. We're on it.
You're working on it.
Oh,
yeah,
totally.
So a cavitation, just like a root canal, if it's chronic, and it's there, these issues, they don't build overnight, but they build, and they can contribute to this low-grade inflammation that ramps up your immune system or can be connected to other issues that are there. Is that correct?
Mm-hmm.
Am I following along with you? So if you, let's go to wisdom teeth. I've had my wisdom teeth pulled out, probably like a lot of people who are listening. And what was told to me is that, hey, listen, it's hard for you to kind of reach back there. Try to do your best to like brush this way and floss this way and have a good diet and everything. This was a dentist who knew what they were doing and was on this spectrum of functional and biological. But if you ever get to a place where I see that you can't reach it and there's like a cavity forming, we may want to consider an extraction because this could be a longer term problem. I'm sure you've heard this before.
Of course.
Right? So I had my wisdom teeth pulled out and I've largely don't feel like I've had any kind of issues. And maybe there's some people that are listening that feel they do have issues that could be related. They're not sure. If you've had any of these extractions or a root canal, is the step one the same? Potentially go find a biological dentist, get this cone beam scan. Cone beam? Am I saying it right?
Yeah, cone beam. Yeah.
Cone beam, 3D scan. It's a 3D X-ray.
Basically, yeah.
Basically,
it's kind of
3D
like
X-ray.
a CT for your head or for
CT
your mouth.
for your head. Yeah. So get that and then see if there's anything on there. Like the dentist is trained to look for these fatty deposits and this inflammation, right? If they're a biological dentist that's especially trained by you, they're looking for signs that something has gone wrong that needs to be addressed. Is that accurate? That's step one?
Step one, yes. And in this case, it's extremely important to find someone who is trained to know about it, because a normal dentist won't know about it.
They may not even agree to run the scan for you.
No, they probably won't do it. And like you get trained to read scans from like professors in Germany, and you have to do an examination for these cone beams to be able to run it yourself. And you have to do 50 dental scans and then present it for the professor. And I found a cavitation on every single cone beam, obviously because I'm trained. And I told this to this guy, I was like, look here, I found a cavitation. What do you think about this? It's called an osteolytic process in the jawbone. He said, you're completely right. But we don't even diagnose it because it's not what we need to diagnose. So they would run cone beams for other dentists that are not trained and wouldn't even put it on the paper to be there as a diagnosis. So it's really not on the realm of dentistry. You really have to find someone who knows about this issue. Otherwise, you have a cone beam and they tell you there's nothing because they don't even know about it.
And so what you're saying is that it's not that those dentists who are trained in cone beam but don't have the biologic training, it's not that they didn't see it. They just don't write it down because they don't know what to do with it.
They don't even write it down because they don't know about it.
They don't know about it.
It's just not on the dental spectrum. It's just not trained in university, so therefore they don't diagnose it. For them, it's just part of the body. Not that this could be connected to something in the system.
What percentage, if you had to guess, right? And I understand that this is a guess.
Yeah.
And again, just reminding everybody, we're not here to fearmonger. We're here to educate. We are trying to present all the different roadmaps of what's available. And many of the episodes that people are going to listen to, it's not going to immediately relate to you. It may not be something that's there for you, or it might be a family member or whatever. But sometimes you hear something and you want to know the options that are there. And we're going to try to do our best in all episodes, and especially this one, to say, we're not trying to freak you out, right? We're just trying to present the possibilities. So for my own question, as somebody who's had his own wisdom teeth pulled out, right? On the bottom side, I've had my bottom lower right and lower left wisdom teeth pulled out. So just one tooth on each side. What percentage of extractions, let's say wisdom teeth, I've had a bunch of teeth pulled out as a kid. I was a vegetarian. I was eating all sorts of soft stuff. I have a very narrow jaw. I'm not vegetarian anymore, of course. I'm eating all the, healthy, omnivorous diet, grass-fed beef, etc., other stuff. I stay away from ultra-processed foods. I try to challenge my teeth and chew tough things and take good care of it and stuff. But I've had different teeth taken out over the years. What percentage of either wisdom teeth or teeth that are extracted have this issue? If you had to guess globally of all the ones that are being taken out, how many of them have this cavitation?
I would say at least 80%.
80%.
From all the patients I see is more like 95%, but I would estimate 80%.
The thing is, probably you're seeing patients at one end of the spectrum because they've tried so many different things. Like you're not seeing a lot of generally healthier patients who don't have any issues and have just had a couple of teeth extracted. You do.
I started with the super unhealthy ones. Like that was I would say like this is the spectrum. I had like the super chronic unhealthy patients. But also these days, I have a lot of athletes and a lot of health optimization people like us, just like us, that want to have the next edge. Bodybuilders, people from all side of things, but the edges. This one needs a 10 out of 10, this too. And they all have the same problem when it comes to tooth extractions because they're not prepared for that surgery.
So 80%, let me make sure I understand this correctly. You estimate out of all teeth extractions, so if you've ever had a tooth extracted, you think it's 80% of people that have this. And then the question is just whether or not it's contributing to a major issue in your life, or whether you're so healthy and you work out and you do everything right that it's not that big of a deal, even though it exists. And I'm sure that people are on the full spectrum. Is that what you're saying?
Completely correct. Because the problem is we are, like us dentists or oral surgeons, when we take out teeth, we only inform patients about the surgery. That you have pain, swelling, we need antibiotics, anti-inflammatory drugs, right? That's round about it. And you have like a school leave. But we don't start to prepare our patients with the right nutrition, with the right lifestyle, with the correct nutrients and micronutrients in order to be able to build bone and teeth. So most of the time, that's why I call that hibernation mode. A lot of dental patients that come in for surgery are teenagers. They are more like in hibernation mode. They're growing, they're eating ultra-processed foods, they have a vitamin D3 deficiency. They're not optimized to do a surgery. And then we're also trained as dentists, me too, as an oral surgeon, old school wise, we're trained to take out these wisdom teeth as fast as possible so that insurance pays for it, basically. So therefore, we need huge cuts, rough surgery, big trauma. That's basically a good surgeon. I think the next level of surgery is as minimal invasive as possible, but only if patients are prepared and are systemically able to be anabolic and build tissue. Because it's just a lack of nutrients and being in hibernation mode. You don't, or like in a stress mode, or even too young. Like in teenage years, you shouldn't do surgeries in the body, if possible. Or if you do, then only like super prepared.
So when I was young, I had really poor dental healthcare, braces, traditional stuff. You know, my parents were paying for the best in town, but it was the standard stuff that was there. They had no training or interest in nutrition or other stuff. They were not educated in any of that. Had braces pretty much my entire high school career, had a lot of teeth extracted in that process to just mold everything around. Then as I started to get into this world of integrative, functional, precision medicine, meeting a lot of great practitioners, and I moved to LA, I got connected to a really great dentist over here. And she was the one that had sat with me and said, great, you know, you're doing a lot of different things, and here are the reasons that I'm paying attention to these wisdom teeth. And she gave me the pros and the cons and said, here's the thing. And so we took the wisdom teeth out. And then also, because she has some level of training, right, of this biological dentistry, integrative functional dentistry, it was also too, let's extract it, make sure you're in a good place for us to be able to do it. Let's clean the site with ozone, right? Let's disinfect it so nothing is there. And then we're going to close it up. So, you know, I'm not asking in your, you know, you weren't there, you didn't do it, you know, but when I'm just me talking from the outside, do you think that I should still get those wisdom teeth checked to see if everything is good?
Depends. I mean, for what I listened to is you were older, right?
This was like, you know, maybe 10 years ago.
So your nutrition was already all right. You're not a vegetarian back then. Yeah. So you probably optimize, have enough vitamin D3 and stuff.
Yeah.
And she did good care. Yeah, you weren't swollen and she used ozone, maybe even took blood to make PRP. I would say you're probably good.
Yeah.
You're one of the few because you were already optimized for that surgery.
Right.
I would probably, if you have any sort of health issue or something that you can't figure out, like maybe you're lacking deep sleep or your REM sleep is off, or maybe you have high cortisol in the morning, or you're a bit more stressed out. I'm just guessing. Like any sort of thing that you say, or your knee hurts, or your elbow is a little bit off, whatever. If there's anything that's nagging a little bit or like blocking you from superhuman health, then I would do a cone beam just to see. For example, this is like my brother. My brother is super optimized, but he had his wisdom tooth taken out. And we just did a cone beam just to see what's happening. And he had huge cavitations. But he's super, like he has nothing. He said, okay, we just do it because I'm interested. What will happen? So he just then told me a month later, it's like, didn't really feel anything, but I need 1 hour less sleep and have the same energy levels. So that's a lot in my point of view to optimize someone's energy levels and needing less sleep, meaning the body's just having more energy for other things.
So let's talk about your brother for a second, okay?
Mm-hmm.
So he had these extractions. You said, let's do a cone beam. What did you see on the scan when it came back? And then how did you treat it?
Obviously, he had his wisdom tooth pulled while he was a teenager eating just ultra-processed food and stuff. So I had that estimate. I was quite sure he had it. So I did the cone beam, and what you see on the cone beam is basically just where the wisdom teeth were. There's no sponges bone, but there's just black, basically. That's what you see. You cannot diagnose a fatty, degenerative osteonecrotic jawbone on a cone beam. You can just write down osteolytic process, meaning you see there's no bone. And then you think from all the 10,000 surgeries you do, probably fat in there. So what we do is prepare my brother with the right nutrition. He was already doing that. So enough protein, healthy, whole food diet, eating real foods, and looking for his micronutrient level, especially vitamin D3, K2, and all the bone healing sciences. prepared him for about 2 to 3 weeks. And then surgery is very minimal invasive, like you said. This is actually the least invasive you can be, because possible to do cuts without any scarring. It's possible. It's kind of like a zipper approach to the gum. And then we only use piezo surgery. Probably that's what your dentist did too. Very minimal.
What was the last thing you said?
Called piezo surgery. It's just a type of surgery that is not more old school with drilling instruments. It's more like with ultrasound. It's not correct, but kind of like that. And then you clean it out. You obviously use ozone. We also draw blood up front and spin it to make kind of like PRP, but it's called PRF membranes. They contain stem cells, growth factors, and then put it in that place and close it up and let it heal while he does all the different modalities to just support overall health, just as intravenous nutrition, hyperbaric. And then also, obviously, he knows for the next 3 to 4 months how to eat, to stay in anabolic mode, and to properly support bone healing and tissue healing systemically. That's it. It's very the surgery part is very, very tiny part of the whole process. And obviously, the way we do surgeries is so minimal invasive that we don't cause any trauma, if possible, as little as possible, because then your body heals better, especially if it's in a, let's say, in a surplus of nutrients.
Yeah, you're only applying local anesthesia.
Yeah, easy.
Right? Minimal, and it's all done within a day.
Most patients actually, obviously, because the word surgery is so bad, because it's obviously because you use a little scalpel, it's called a surgery. But it's so minimal invasive. Even taking out a root canal, it's basically pain-free. People always estimate, surgery, they're so afraid of it. But then they say, wow, it was nothing. Like, I didn't even feel anything. And my goal is obviously, but because we do all the things around it, so that the patient on the next day has really almost no pain, little swelling, if possible, even none. So that's the goal, obviously, because I'm just there to help that body heal. That's it.
When you opened it up and you saw inside and you extracted and cleaned out what was there, what did you see? On the cone beam, you see a dark area.
Yeah.
Right? So you're seeing that there's an abnormality and you're guessing that something is there based on his sort of medical history. When you opened it up, what did you actually see and what did you remove?
Yeah, it looks like, if you open up, it looks like a chicken soup. Like oily stuff comes out. It's no bone at all. It looks really yellowish. You can usually basically suck it out, actually, with a suction. It looks more like just tissue, a little bit like tumorous, really nasty. And
does it smell?
Sometimes it smells bad. A lot of patients that fly in from America have huge mold issues. And mold spores tend to live in these cavitations because they love the mercury and everything. It's just a perfect environment for them.
How do you know there's mercury in there? Have you ever tested it? Have you ever looked at stuff inside there?
Yeah, I haven't done the test, but there's one guy in Germany, I call him the Yoda of cavitations, Dr. Johann Lechner, because he's old. He's like 75 or even 80 years old. But this is his whole life's work. His work is cavitations. He has done all the research. He has all the arrows in the bag always had. And he did all the studies and also combined and put together all the research. And yeah, they did a lot of testings, sent in all the stuff for these ranties, for the chemokines. There's even a study from him with a immunologist from Germany that look at his ranties from the cavitation side and connect it to breast cancer because of the activation, the ongoing chronic inflammation triggering that breast cancer. It's not a causative study, obviously, but it's a big correlation. There's so many. They found mercury, they found glyphosate, and parasites, mold, all of that stuff. So it's not me making up things. It's just there are thousands and thousands of cavitations have been sent into labs to test that. It's possible. Even here, lots of the real biodentists sent that cavitation stuff in to see what microbes live in there. It's crazy. We don't usually do it standardized because it's an extra money they have to spend. Let's say it costs another 500 euros and we already know and see and have all the data. So we don't actually need to do just on paper to have like a reading of which microbes were in there. It's not interesting for all patients. We only do it for the ones that are interested in it.
So I've talked about this topic a little bit in the past. I've mentioned to you before we started recording. And I got a bunch of dentists who wrote in and said, listen, I appreciate that you're covering these topics. There's some things I agree with. There's some things I don't. And I want to tell you, and also maybe the dentist that you were interviewing at the time, that the approach to root canals has evolved a lot. And we don't do things how we did even 10 years ago in traditional dentistry. I think they're sticking up for traditional dentistry. And, because ozone is more often used or other cleaning things and other stuff, we don't have as much of this. And that's why I feel like you guys didn't talk about that. Is that true, false, somewhat true? What are your thoughts on that?
Obviously, a root canal is called endodontic treatment in dentistry, and there's obviously specialists for it, which will use a microscope to do a root canal treatment, use ozone, use various things to make it more perfect. And obviously, these root canals are better. But let's face it, 95% of all dentists will have a conventional root canal treatment because a root canal done by a specialist is expensive. They just go with the normal one that maybe insurance pays. And this is just rough work. It's not really specialized. And the problem is, even with the specialists and the root canals done by microscopes, it's just a matter of time that this thing becomes reinfected because of the dentin-tubal issue, because of the periodontic thing. There's one great researcher called Boyd Haley. He's actually a biochemist, an older one. And he invented a test where you can actually measure in the sulcus, which is like the part around, like the gum on the tooth, the first millimeter is open. It's not attached. That's called a sulcus. There's fluid in it. And you can measure, or they could measure, the metabolites, the metabolite byproducts of these anaerobic bacteria, which are highly toxic sulfur compounds such as thioethers and mercaptanes. And they could measure it and see how toxic that tooth is. But he said basically over time, any single root canal will become toxic again. Some take maybe 10 years. Others are problematic in a year. But also, there are patients out there, they're so resilient. They can smoke 90 cigarettes a day and drink beers in the evening and have 10 root canals and they're still fine. But you know that the health is degrading and the younger generations are not as resilient anymore. And they might have a problem with just one cavitation or one root canal. This is why I want to bring this to attention. So
part of what you're saying is that, yes, there is some truth to the idea that endodontists in particular, who are more specialized, do have better tools and are doing it better. But the vast majority of people are not going to a specialist for a root canal or a cavitation. So they're ending up with symptoms and issues because often they're just not done well in the first place. So is that accurate?
Yeah, no, it's perfect. The problem is that most of them are not perfectly done. And also that even though it's
they can get reinfected later on.
And also, if you really precise on diagnosing root canals, and this is studies from dentistry, within the last 20 years, we got way better at x-rays. So if you really look at three-dimensional x-rays, and not all dentists, I would say it's 15 to 20% maximum of all dental clinics have a three-dimensional x-ray.
I would say even less than that.
Probably even less than that.
Yeah.
That's why, because the machine is expensive.
Yeah.
It's like $100,000 plus. So if you precise and look at every single root canal on a cone beam, you find sorts of chronic inflammation. Does it mean that the patient has pain? No, still can bite on it. But for us, we're like, oh, wow, there's something.
So the question is this, okay? So if I understood correctly from, you talked about your brother's experience, you go back in and you do these cavitations correctly, right? What do you call that procedure? Like the cleaning of the procedure? Like,
let's say cavitation surgery. Just
so cavitation
clean it using ozone. Yeah. Just basically reactivating it because it didn't heal 20 years ago when he had the initial wisdom teeth pulled.
Yeah. And there are some, it's not common, but there are some, if I heard you correctly earlier in the interview, there are some rare times that you'll still do a root canal. That if somebody's having pain or no?
We have to. Because we have general insurance in Germany, we have to do root canals if someone presents with pain. And also, obviously, we like to do it. Why? This is the next thing we can touch on. A root canal it's a dead body part, of course, but the tooth is there for biting still, out of pain. And the tooth itself keeps the complete anatomical structure, keeps the gum and the bone alive. So if you just take out the tooth, like rip it out or yank it out, like a lot of patients are afraid of, then what happens over time is that the socket, it collapses. So it's always actually good to initially have the root canal done, but like we already discussed, work on a strategy for the long term. What would be the ideal solution for a chronic infected or for just a root canal in the long run? What would be ideal?
So here's a question that I'm sort of not connecting the dots on, and I'm curious about myself. So you said with a lot of these other people, even these endodontists, if they do a cavitation, if they do a root canal, it's only a matter of time before it gets infected. So what are you doing differently to make sure that that initial infection doesn't happen? Yes, you're making the patient's health better. You're having them have appropriate levels of vitamin D, these fat-soluble vitamins. You're improving their overall health, gut health, nutrition, but how are you avoiding the initial infection in the first place, even though you're doing root canals and cavitations?
The cavitations are different.
Okay.
So cavitations, if you do the surgery properly and clean everything and just basically reactivate that area so that your body builds bone, I would say in 90% of all cases, if the overall healing process works, your body will build solid bone, no more infection.
So bone is built in that area.
Exactly.
And it's closed up and there's no room for anything to happen.
Exactly. Problem was with the initial wisdom tooth extraction, there was no material to rebuild it. So therefore it became a chronic infected site. So we just basically reactivate it, make it acute again, bring in blood, bring in liquid healing, and then it just grows bone. It takes about 3 to 4 months. But this is something that the endodontologist doesn't do. The infection that comes again is for most of the root canals, because it's just the problem with the endodontic treatment is over time, because of the anatomy of a dead tooth and the bacteria in your mouth, they just go back in there, even though you have the perfect root canal, because you cannot clean the dentin tubules.
So how are you avoiding it? Because you're still doing root canals. Like, how are you avoiding that reinfection?
Yeah, the root canals for us is just a temporary.
Temporary. Got it.
Just a temporary. They can still bite on it. They're out of pain. So they're out of pain. We can then make a complete program how to optimize his health or her health starting from the mouth. So what we do is then sit down and make a treatment plan, kind of like an architect for your health, and see, okay, here's 5 root canals. Here's a titanium implant. Here are 4 cavitation sites and a lot of metals. How can we make this dental repair as biocompatible as possible? Are there materials available that are not triggering the immune system, that are not stressing your nervous system, that are just basically neutral to the body? Because obviously, ideally, you don't have any dental repair. Like ideally is our teeth. No cavitation, nothing, right? No cavity. So then we plan for these patients. Obviously, they come in for a reason to see us. I'm in a bubble, obviously, because I've built that way. So they come in, and they know, okay, we take out all root canals, clean that site, use ozone, do the perfect surgery protocols, and immediately, for the long term, place a ceramic implant where that tooth is gone. Why we do that is, like I just said, if you just take out a root canal, you basically end up having no bone later, or a little less or less bone, because the socket just collapses. It's called alveolar atrophy. Kind of like if you don't use it, you lose it. Kind of like training. So we place that ceramic implant, which is qualified as a true biomaterial, meaning it's completely neutral to the body, in the socket and keep the anatomy alive. We could actually prove it with our research. I wasn't able to prove it 5 years ago when my book came out. And actually back then, a ceramic implant wasn't medical guidelines. But now, 2023 onwards, it's finally medical guidelines. So now dentists, if they do an implant, like replace a missing tooth or root canal, they have to give patients the option. Here's the old school titanium one, the gold standard, or we have also the ceramic white one. Which one do you want to choose? So now they have to. But I'm doing this for more than a decade and only use ceramic implants because it works beautifully. It's just an ideal tool to restore something that could be chronically infecting you or make you chronically inflamed with something that is neutral to the body. That's it.
So you have the choice, always choose ceramic. Because that's going to be
ceramic.
The only thing that's not going to be potentially triggering this sort of autoimmune reactivity cascade, etc.
I mean, metals that we use in dentistry, none of these metals have any function in the body. Never had. So it's always a foreign body part to the body. So it's always a trigger for the immune system. Being it mercury or gold, it doesn't matter, or titanium. The immune system will always somewhat have to balance it or get triggered by it because it's just metal particles.
Yeah, it even happens. You see this with the whole trend of some women, not all, having reactions to breast implants and that whole movement there, breast implant illness,
yes,
BIL, whatever the abbreviation is. And actually in LA, there's a whole group of surgeons that I've met over the years.
Yeah.
A couple of them that come on this podcast that said, for years, we were ignoring women. We were not listening to them saying, I have autoimmune symptoms now. I have this, I have that. Is this at all connected to my breast implants? And we just started listening, even though the FDA said, and these companies said, there's no issue, there's no issue, there's no issue. And then finally, we started believing and listening to these women and taking it out and saying, look, we don't know if you're going to get better, but let's try. That was the early days. And many of the women started getting better with these explants. It's called an explant, taking it out and in some cases putting fat in and making sure that the breast
looks okay
for the woman, depending on her choice. And only years later did the FDA finally come out and say, hey, with these certain type of breast implants, not all of them, but these like ribbed ones that have kind of more texture on them or something like that, those have shown a link with some chronic diseases. I can't remember if it was cancer, autoimmune, something, but it takes years sometimes for the medical infrastructure to come back. Meanwhile, all these patients are suffering, and the biggest advocates are these women themselves. I had a good friend of mine that come in this podcast that she was having so many unexplained health issues, and she got pressured into getting breast implants in her modeling career. Her name is Sarah, and they often become the biggest advocates for, hey, we may not have all the research yet, but we're suffering and we need a different way to approach things.
Yeah, exactly.
There's a lot of parallels.
Or Yolanda did that too. So Hadid. Because, and I think this is what we need to stay. We just stay humble as doctors. I don't say that I know everything, nothing at all. I'm just looking at the same thing. Like, this patient has these chronic health issues, and maybe it is the breast implant. Maybe it is this implant in the mouth sticking in your jawbone and then connecting to the nervous system. Just be open-minded and just don't shut down and say, no, it's not possible. That was one of my experiences at the residency. I was at a very great surgeon. I was really fortunate to learn very good surgery, but he was an old school dentist placing amalgam fillings and just do basic foundational, like not very great dental work, but very good surgeries. There was one patient, an old lady. I remember to this day because she asked me, I always have this the high CRP, the HSCRP was always elevated and no one finds something.
A marker of inflammation for those that are not familiar.
Exactly. And I was just fresh from university, but I was already on like that health optimization journey for me personally. And she asked me, do you think my oral inflammation, because she had a lot of bleeding gums and periodontitis, could that be linked to this? I'm like, yeah, why not? Makes sense. Then my boss comes in and is like, no way this is connected, can't be possible, and just shut her down. And I was like, oh, sorry, I didn't know. I was just assuming, of course, it could be possible.
You were being open-minded.
I was just like, why should this not be connected? Because it's part of your body. Yes, there's a huge inflammation. Of course, it works systemically. But this is the problem. They're not usually open-minded. And the older generation, especially also in Germany, they're extremely scared of change, especially when it comes from someone young. I understand now why I got critiqued like 10 years ago, because I was only like 30 years old, presenting stuff on stages, just being like more like playful with it.
You were being a little bit too maybe loosey-goosey, a little too liberal.
I was too loosey-goosey.
You believed in it, but maybe the data wasn't there to back it up, or the connections or the education.
Exactly. I tried to present it as perfect as possible. Obviously, always missed the dress code, coming like this on shows instead of having a suit, stuff like this. And then obviously I understand. I'm a fan of change. I love if I learn new things, but I didn't realize that most people are not.
Yeah.
So that took me a while to figure it out. And now I realize, okay, it's all about just informing people, especially our colleagues. But then if there's any dentist listening and they're just skeptical, but open-minded, that's perfect. Because that was my goal, to explain it to a skeptical medical doctor on every level. Science is on every level, and show them the research, how this is all connected. Obviously, they have to learn these traditional knowledge gaps that we have. But if they do, they will improve their game. And I have one perfect example is, actually, she became a good friend of mine. She's a good friend of the family. She's a very strict medical oncologist, my age. She was always questioning me, like always for years, like on this, like really uncomfortable. And I could always give a solid answer to her. And at one point she's like, dude, for 10 years I tried to get you, but you explain it so perfectly. I'm doing your protocols now. I'm using it in oncology. It's amazing. Like, you open up everything. It took me 10 years to realize it, but this is also the impact I want to have. Just melt all these medical doctors and coaches and trainers, everyone that is interested in optimizing anyone's health on every level, melt this all together and build systems in co-elevation style. That's what I'm there for. Like, build the wolf pack to help as many people as possible.
I love it. It's a beautiful mission. And, I appreciate the vulnerability of you sharing your brother's story. I'm sure you've had other family members that have gone through that.
Me too, personally.
Can you talk about your personal story? What was going on?
So this is how how I personally found about these cavitations was, like, I had bad skin issues and I was already optimizing my health.
Like what? What kind of skin issues?
Eczema, like red, not really acne. I had acne as a kid, but then later in years, like let's say from 25 onwards, always eczema, always here and here, where my hair is on the higher forehead and below my eyes. Always red, itchy, burning. Everyone would point to it. This was what I hated it. Every single person was coming in, oh, what's with your skin today? It's because of your diet. And I'm like, no. because I was already doing the nutritional approach of things, teaching people about nutrition, and I knew this is quite solid nutrition. It has another aspect, and I knew from my studies that skin issues are always a neurological issue. And I also had, in the morning, I had like a little bit of a shakiness. Felt like Parkinson. I was like, will I get Parkinson or autoimmune problems? I'm only 30 years old. And I was grinding at night like crazy and always a little bit tense. And obviously I'm more like a more adrenaline guy anyways from my personality. So there was one day in the clinic where we had like a shadowing from a naturopathic doctor. And he was also like myself, I'm a naturopathic doctor, and him too. And he was saying, let's test it with ART, autonomic response testing, muscle testing. Let's test. There's something because you're so tense today on your skin. So he tested everything and he said, there's something in your jawbone. I'm like, what do you mean? Let's do a cone beam right now for you. And I'm like already a surgeon and doing all the things for patients. And like, I have nothing. What do you want? Okay, let's do the cone beam. So I looked at the cone beam and was like, it's not possible, man. I have like the biggest cavitations I've ever seen. And then I remember, of course, I had cavitations. I had my wisdom teeth pulled, but I didn't connect the dots for me because it wasn't so big on my radar that cavitation is a thing. I just had heard about it. So obviously I saw that cone beam and he pointed my health issues systemically to this one. I'm like, can we do a surgery straight away? Like, can we do this? So my doctor's friend, like we were two surgeons. We just said, okay, let's do the surgery. You guinea pig, you patient zero. Let's try.
He had not done it before? He had not done it?
No, but he's a great surgeon. So if you're a great oral surgeon, it's kind of like a wisdom tooth extraction.
Yeah.
You have just know how the anatomy works. It's not a big deal.
And before you continue on, how long ago had you had your wisdom teeth extracted at that time?
I was about 30 years old, so 15 to 16 years already.
15 to 16 years.
So I think they were extracted around about when I was 15 years old, very young. And I remember that I had these issues. My lifestyle was really bad, eating all processed foods, smoking cigarettes a lot, drinking a lot of alcohol. So not prepared at all for surgery. And I remembered that it was pus coming out. I had to take more antibiotics and it just didn't heal. I remember that. So it made sense to me then, but I didn't look at it. So we did the surgery kind of unprepared. Already my nutrition was on point. That's why it was good, but we only did one side because we thought maybe better just start one side and more conservative. So he did my right side. After a full day of my own surgeries, just in the evening, we just did my surgery at the end. So not really in a healing mode or anything, just on the chair, come, let's do it right now. Injection, surgery. And during that first surgery, I was like, it's not possible. My mid-back pain goes away that I always had too, mid-back pain. And I had to laugh. I was like, is this even possible right now? Like, I'm very sensitive about my body, so very in tune. So I felt this one. And I had massive pain because I wasn't prepared. I had no anti-inflammatory drugs at home, but it felt good. And on the next day, I woke up and the shakiness was gone.
Just one day later.
This was one day later, but my skin was still okay. But my skin was still not good. And I was like, oh, damn, but I have the other side. So let's schedule in the other side. So I let that one heal. I did everything wrong that you could do wrong. We did the surgery after a full day of my own surgeries with patients. I had this next day scheduled for 12-hour surgeries with patients. So I didn't do my own protocols of being relaxed. So I had the swelling and everything. But anyways, I felt great. So 6 weeks later, and I noticed exactly it was Christmas time 2013 or 14. I had really bad skin. And he did that surgery. And within the next 10 days, my skin was perfect. Like now, some pimple here and there, but no more eczema.
Yeah, your skin looks good.
It looks good, right? And it ever stayed that way from that point on. And obviously, if you experience all these things, like multiple things for me at the same time, doing one surgery, I personally have the moral obligation to just preach every single one. Like, maybe this is something maybe, but I wouldn't have, for me personally, not doing this would be really bad because I would still look for something to get that skin in order. And I didn't even connect my back pain and my shakiness with it. And I also have data from, I don't know if I still have it, but we did my cortisol levels prior to that, not connecting it, but I had high, very, very high cortisol in the morning. This is also my genetics, but it was super high. And I remember that after this, it was at least half. Still super high, but half. I'm just a hunter type of person. I just wake up in the morning being present. That's just my nature. It's not bad. It's just how I am.
So you had the cone beam, you got the surgery done, and you have your N of one story, which has influenced a lot of your career,
End of one, yeah.
right? And you've now seen and you've built up, people forget there's randomized controlled trials, but evidence-based medicine isn't only randomized controlled trials. It's also clinical experience. That's evidence-based is the clinical experience. Now, every clinician is influenced by their own story, by the people that they treat and other things, but we cannot discount it completely. We have to measure it as part of, hey, maybe because there are people, and in fact, many advances in medicine start off by physicians, dentists, other experts in healthcare speaking up and say, hey, look, I know everybody says that the best way to treat this is X, but I'm seeing that when you do that, Y happens and Y is a bad thing. We all should be questioning. This, by the way, for anybody who thinks that this doesn't happen, this happened during COVID. We were putting people on ventilators and doctors started speaking up and saying people are dying earlier when they got put on ventilators. They were asking Elon Musk if they could build a bunch of ventilators for America, and he was gearing up for that. And everybody said, whoa, 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 ventilators are bad. It gets the virus directly into the immune, not passing, the breath, the lungs, the nitric oxide. It's going right into the body. So this happens all the time in medicine. And that was your experience that got you to have an open mind and have a change of health. And you said, okay, I need to be focused and dedicated to helping patients, but also I'm only one, naturopathic doctor and dentist, so let's train other people.
Because I realized, okay, I might do 30,000 surgeries myself, which helps no one. But if I train 1,000, and they also do 30,000, it's like millions of people that we can really help get to optimal health and actually teach that this is even existing. And what you just said, science is not research. Science is next levels, people that are exploring new things, like you just said. There's always the next level, and research is just what we agreed on. So actually, because what we did 10 years ago, and I've done over 10,000 cavitation surgeries and more than 5,000 ceramic implants. I'm the vice president there. So we actually do a lot of clinician work, but we have the data for the guys with the research. So we have a lot of studies with universities now. So now we have good professors in universities using our data from clinical to doing their amazing research, because I don't have time to write a lot of research papers. I want to help patients and change the game. But this is all connected because it's super important that we have science, but also the clinical part of things. And this is how we evolve. If we just agree on everything, okay, this is how it is, then this is like we're dying. It's always evolution goes like this, goes up, goes down, and then next level, next level, next level.
Right. There's always the next generation of people that have to push forward medicine.
And there's only a handful of them. Most of them, people are not comfortable with that.
Right. And in fact, you're going to get a lot of as you said. But people are waking up because a lot of people are realizing, some of my most open-minded dentists are the ones who have then changed their diet, have started eating protein, lift weights. And they're like, nobody told us that these things were like exactly how they were good for us. And they, if you go to your doctor, they just say, hey, eat less and exercise more. And they don't even give you any guidance on what type of exercise.
Maybe they even fat and smoke. So it doesn't even make sense.
Right. So they are having their own awakening and saying, okay, maybe there is something else to the story with mercury amalgam fillings.
Yeah.
Maybe they're not as, maybe the science isn't settled, so to speak, which was a big term that was used here in the United States during the COVID pandemic. Maybe there is more to the fluoride story than what we're being taught in dentistry, right? And I know we didn't touch on that, but maybe there's more to root canals and cavitations. Maybe there's more to nutrition.
Exactly.
And, we spent today's entire episode, and we've run out of time, unfortunately, but I'm glad that we took today to go deep into root canals, cavitations, how health and disease starts in the mouth, because once you really get that, I start to see that people become more interested in the other topics as well too. So this has been fantastic. And I'm just want to say it's been an honor to get a, shout out to our mutual friend, Max Lugavere, who connected us. And if you're around here a little bit more, I'd love to continue because you have a lot to say about nutrition. You have a lot to say about fluoride and better alternatives that are out there. You have a lot to say about mercury amalgam fillings and the latest. And then there's even some other categories that you're also kind of leaning into and have some thoughts on, peptides and other interventions that are there. So I'd love to have you on for a round two. Let's tell the people where they can find you, find your clinic, the database, all that stuff, and keep in touch with the incredible work that you're up to.
Thanks for having me, Dhru, and thanks, Max, for connecting us. So the easiest way to find me is actually the Instagram. It's Dr. Dom1, and I think you added in the show note.
I like how you say the Instagram.
How would you say it?
Easiest way to find me is Instagram, but it's cute because my parents, they'll say, oh, I was logged on to the Facebook. We're Indian and they add the Facebook in front of it, but it's just a little funny thing that I was mentioning.
Cool,
okay, so you're on the Instagram.
Yes.
What's your handle?
Dr. Dom1.
Okay,
DOME1.
Great.
And there's most things connected. We're working on all it. I also have a webpage called Dr. Dome Official that you can find. You can find probably everything also there, like the book. The clinic is DNA Aesthetics in Germany. It's all linked. And I think I can give you all the show notes anyways. Then the training is the Institute of Biological Dentistry for any dentist that would be interested in becoming a real biodentist to upgrade all his teachings. Yeah, so I'm trying right now to put all the things I'm doing together and make this mission even bigger to help even more patients or people. Because people are, as you know, they're kind of suffering, and we can change that so that everyone has like a great life. And this is why the real biodentists, for example, also start by changing themselves. Always lifestyle, nutrition, everything. Because only then I feel if you practice what you preach, only then you can really inspire even your patients to become healthier.
100% said. And I just want to acknowledge you as we close off here and with some gratitude, which is that, what I see is that when people like you who are, trying to pave the path in something like cutting edge, you're going to get a lot of things right. And there might be some things over the course of the career, because you started when you were young. You might have things not wrong, but you maybe misinterpreted something or it invites criticism. And even if you get everything 100% right, you're still going to get criticism, right? And I see that sometimes when you get a lot of criticism, you become very evangelical and you're like, this is the only way, because you feel you have to fight. And instead of saying, maybe this could be part of what's part of your fixing your health, you're like, this is the only way. This is how you do it. You have to do it that way, because people get so much arrows in their back. They feel that they have so many shields, but those shields blind them.
Yeah.
And I feel like even as much as criticism as you've probably gotten in your career, and so much love from patients that have gotten better too, so that's part of it, you've done a good job to keep a very open-minded approach. You're not fear-mongering, and you're really just focusing on educating the patient and the public that's out there that there's other ways to potentially heal if you haven't considered them before. So just want to acknowledge you for that.
Thanks. Yeah, I feel if you're still dogmatic, I've been that too at one point of time. I'm doing it for such a long time on every single level that if you master things and you put it all together, you realize you know nothing. And there's so much more to learn. And this is the good part, because it's a journey for all of us.
Yeah. The wisdom in knowing that you don't know it all, right? And yet you can still help people.
Yeah.
Dr. Dom, this was fantastic. Thank you so much for coming on the podcast. I hope we get a chance to do a round two very soon.
Thanks for having me.
Hey, YouTube, if you enjoyed what you just saw, keep watching for more great content on how to improve your brain and your life.
And tongue health was a way of knowing, what your patient was going through. You could tell by the coating on the tongue, the color, parts of the tongue that were affected, geographic tongue, that's a modern term that we use, nutritional deficiencies,